League of Women Voters of Collier County's program. I am Janet Hoffman, a co-president of this local league. It is wonderful to have all of you here. As we have both members and the public, I'd like to share one of our missions, which is empowering voters. And this is greatly facilitated by being better informed about our own community. And that's what we're going to do today. We are thrilled and honored to be able to have local behavioral health professionals and advocates who care about improving the quality of life in Collier County. Mental health issues, including substance abuse, are on the rise, and they affect not only the individual, but the health of the whole community. Today, we will learn about a brand new coalition working to address this, the Collier Coalition for Healthy Minds, and they will inform us of their areas of major focus. Before we get started, let me mention a little about our Zoom format. With the webinar format that we are using today, you will be only able to see the speakers, not the participants. We won't get to see you, so you can eat your lunch now if you want. After the panel of 7 have each had a turn to speak, we will have a question and answer time. Questions are to be typed into the Q&A box at any time during the program. The Q&A is accessed on your control panel, either at the top or the bottom of your device, usually near the symbol of the microphone and video camera. You will just click it to open it and then use your keyboard to type in your question and then hit the return button to send it. Please do not use the chat box. Use only the Q&A box for your questions. And so first, I get to introduce Michelle Mcleod, who is an impressive mental health advocate. She is a former Naples City Council member and now is co-chair of the Prevention, Education, and Advocacy Committee of this coalition. And she is the one who will be reading the questions during our Q&A session. And so now I will turn it over to Michelle Mcleod.
Thank you, Madam President. Good afternoon, members of the League of Women Voters and guests. Thank you all so much for your interest in the work that's being done in the county to address mental illness and substance use disorders. It is very fitting that we are here with you all today because May is Mental Health Awareness Month. Again, my name is Michelle Mcleod, and as President Hoffman said, I am a committee member of the newly formed Collier Coalition for Healthy Minds. Just to give you a little history on how the coalition got here today, in 2016, when Commissioner Andy Solis took office, he started to explore how the county was addressing mental illness and addiction. And a realization was made that the county did not have sufficient infrastructure to address the crisis, the mental health crisis in our county. Then in 2018, as a direct result of the passing of the 1-cent sales surtax, funding for a new mental health facility was added to treat those in crisis. From there, the Board of County Commissioners created an ad hoc committee consisting of mental health and legal professionals and mental health advocates, and they challenged us with developing a plan to help improve the quality of life for those living with mental illness and addiction. 1 year later, in 2019, the ad hoc committee presented to the county commissioners the very first Collier County Strategic Plan for Mental Health and Addiction Services. The 5-year strategic plan consists of 6 priorities and 2 special considerations, those special considerations being for our veterans and our seniors. Today, the coalition members are going to give you a brief update on the progress report of the county strategic plan. Nancy Dauphiné, COO of the David Lawrence Center, is going to be speaking on priority 1 regarding the new centralized receiving center. Dr. Pam Baker, CEO of NAMI, the National Alliance for Mental Illness, is going to be speaking on priority 2 related to housing and supportive services. Judge Janice Martin, County Court Judge running the county's adult drug court, is going to be speaking on priorities 3 and 4 related to collaborative data reporting and increasing the effectiveness of the court system. Lieutenant Leslie Weidenhammer, who heads up the Mental Health Bureau for the Collier County Sheriff's Office, is going to be speaking on priority 5 related to the Baker Act and Marchman Act transportation plans. And finally, Dr. Paul Simeone, VP, Medical Director of Behavioral Health at Lee Health, will be speaking on priority 6, prevention, education, and advocacy. After our presentation, we'll open it up to questions, just like President Hoffman had mentioned. If you could just type in your questions in the Q&A section of this webinar, we will address them from there. Now, before we get into the strategic plan, and in an effort to tear down the stigmas related to mental illness, we invite community members to join us in our presentations so that they may share their direct or indirect experience with mental illness. Today, our special guest is Angela Goodner, who happens to be the executive coordinator for Commissioner Andy Solis. Angela is going to be sharing her story of how mental illness has affected her family. Angela.
Thank you, Michelle, and thank you to the League for the opportunity to be here today. So when I was very young, in preschool, I started to notice the whispering. At family events, I would see my mom's sisters and my grandmother huddled in a corner whispering. But when I got too close, they would turn and change the subject. My grandmother might say something like, "Little pitchers have big ears." And indeed they do. Now that I knew that there was something to hear, I got sneaky and started hiding under the table or crawling behind the couch. And so gradually I began to hear bits and pieces. Poor Kathy, I'd hear. Kathy is my mom. All the neighbors saw it. And thank God the new neighbors don't know anything about it. Eventually, I overheard enough to figure out that it was my dad who had done it. And it was a bad and shameful thing to have done, but I never could figure out what it was. I was a little girl in maybe 3rd grade when my father just disappeared, didn't come home from work one night. My mother was teary and very vague about where he was or why or when he might be coming home. My aunt and my grandmother lived far away by now. There was no opportunity to play spy, so my sister and I would huddle after bedtime in secret meetings to try to figure it out. Eventually, we decided that my dad must have a girlfriend and our parents were going to get a divorce. It had happened to some families we knew, and so that seemed the logical thing to us. That's what I told my friends at school, and a teacher even called my mom. But then a day or two later, my dad was back. Nobody said anything. Everybody acted like nothing had ever happened. I was in middle school, a tween, when we got the terrible call that my Aunt Margaret had died. My aunt and my father were very close. They were the most alike in their family. And this was very confusing because Aunt Margaret was in her 30s. We had just been to visit her the prior summer. Nobody had ever said anything about her being ill. My dad flew to the funeral alone. It was very heavy on his heart. It was visible, but he never spoke of it. And I was 19, living away from home for the first time when my boss came to me in the middle of my shift and said that a friend of the family was on their way to pick me up, that I should gather my things and wait in the break room. He wouldn't say anything more, really wouldn't make eye contact with me. It was clear that something terrible had happened. But I was shocked when I heard that my funny, sweet dad was dead, and devastated when I heard the word suicide. So now I barged into those whispery circles in the kitchen and I started asking questions. And I was told that I was just a baby the first time my father tried to kill himself. That was what the neighbors had seen, the police cars, the ambulance in the driveway. That was that first shameful secret. I learned that when I was in grade school, my father had used the then new Baker Act to voluntarily surrender himself for treatment in a local mental health institution. I think now how brave that was, and how fortunate we are that that law exists. But then it was considered so shameful that people let us believe that my father was going to leave our family rather than that he had gone in for really basic medical care. And it probably comes as no surprise at this point to learn that my Aunt Margaret's death also had been a suicide. I think now about my little cousins and their own tale of secrets and stigma and shame, and how they couldn't even share it with our family. And now I watched the stigma play out for my mom. I grew up watching the women of our church show up for families in their loss and help them get through those first days and weeks, often with my mom in the lead. But we were more likely to get cards in the mail than visits in person. Our neighbors sent their condolences, and then they waved from a safe distance across the street from their driveway. My sister was in her senior year of high school. She watched friends and even teachers just be uneasy around her. She'd always been a little of an introvert, and she retreated even further and ultimately decided not to attend any of her graduation events that year. Our loss made people uneasy. They didn't know how to react, and for many of them, it was easier to just avoid us. Now, that was decades ago, and there's no doubt that the taboo around mental illness has lessened since then, but too much still remains. Even now, study after study tell us that while in the abstract, people understand that the medical or genetic nature of mental illness and the need for people to seek treatment, but they still are uncomfortable and often have a negative view of the individuals who seek that treatment. So even today, stigma prevents people from accessing the treatment they need, for asking for help, and it keeps caregivers like my mom from getting the support that they need. The internalized shame of self-stigma continues to lower self-esteem, shut down hope for the future, and according to research, even reduce the effectiveness of treatment if it's even sought. Stigma in the political space still affects issues around insurance coverage, funding for mental health treatment and research, and how the mentally ill are treated in the criminal justice system. So my colleagues from the coalition are here today to tell you about what we're doing here in Collier County to help save lives. My part is to honor my family by sharing our story and hopefully helping create a culture that is free of that kind of stigma. Thank you for the opportunity to do that.
Thank you, Angela, for sharing your personal story. It's so important that we do this so that others out there know that they're not in this alone. And when we share our stories, it opens the door for others to share their struggles so that we as a community can be there for one another. So with that, let's hear from the coalition members as to all of the many efforts that are being done to help with these efforts in the community. Nancy?
Thank you, Michelle, and thank you, Angela, for your brave sharing today and all that you do to help support mental health in our community. I'm the Chief Operating Officer at David Lawrence Centers, and my background is as a mental health clinician, and I am happy to be able to be here to speak for a few minutes about priority number 1 of the strategic plan, which is to build and operate a central receiving facility or system to serve persons experiencing an acute mental health or substance use crisis. So a central receiving system in brief, and there is a lot of great information in the actual behavioral health strategic plan. That document is really rich, But what a central receiving system, the idea is, and there are many of these throughout Florida and across the country, a central receiving system or facility is built around the notion of no wrong door. So the idea is that individuals who are experiencing a crisis can come to this central hub and experience the care they need without being transferred or directed somewhere else or told that they need to go somewhere else. They can get help immediately. And we know that the need for Baker Act and acute substance use crisis services under the Marchman Act has been growing over the past 20 years, and it's been growing well beyond the rate of population growth. So we have a need for additional beds to serve individuals in crisis. So where are we now? We know, well, there was a penny sales tax referendum that was voted into effect that is funding many community initiatives, and one of those is a $25 million allocation to build a central receiving facility. So where are we now? We are the county has voted to build this new center on 5 acres of land near our David Lawrence Center main campus. This will be the location of the Collier County Mental Health Facility, and it will be, the land has been donated to the county and it is owned by the county, and there will be an operating agreement and lease, and it's expected that where we currently have our main behavioral health services and continuum of care for crisis services, where we've been providing those for up to almost 50 years of behavioral health services and over 30 years providing crisis services in this location. We hope to double the capacity for inpatient care in that new facility. And so now the design process is beginning in order to develop what would be the best practice for a central receiving facility. We are so appreciative that the voters supported the referendum to allow the funding to expand this greatly needed service in our community. I want to make sure that I thank all the voters for that vocal support through the referendum. And also there is a continued call to action for everybody to continue to be vocal supporters of the expansion of care for behavioral health. We need more crisis beds, and we need more support at large from the larger community. And that includes from government support to philanthropic support to everybody being an ambassador for the need for mental health services and to reduce that stigma. And I know we'll hear more about that from the rest of some of the other panelists. So again, I just wanted to let folks know that we're in the design phase, working with the county to help advise and build that new facility that will house both Marchman Act, which is the Substance Use Crisis, and Baker Act, which is the Mental Health Crisis Act, and to ensure that there's capacity for individuals to come with no wrong door. It will be owned by the voters, the community, the county, and operated in partnership with David Lawrence Centers to continue to expand the crisis work that's been happening for many years in our community. We continue to see increased demand, even in the midst of the pandemic. We're seeing increased numbers of over 30% demand in our current capacity in our current beds, and we need this more than ever. So hopefully we will see shovels in the ground soon, and that new building coming before we know it, hopefully maybe 2 years from now. So I'll be here for questions, and I'm trying to stick to my 5-minute time limit. So I hope I'm doing all right with that. And I will pass the baton over to the Executive Director and CEO of the National Alliance on Mental Illness in Collier County, Dr. Pam Baker. Thank you.
Thank you, Nancy. Good afternoon, everyone. Sorry, I just started a lawnmower outside. I apologize. Do my best to get around it. I'm going to be talking about our second priority in the strategic plan, which is housing for people with mental illnesses and substance use disorders. For that group of people, we consider housing the golden thread through which all other aspects of recovery are possible. Without decent, safe, affordable housing, people with substance use disorders and mental illnesses will cycle in and out of jails, hospitals, crisis units, all of which are far more expensive than our solution, which is to provide housing. For people with serious mental illnesses, a lot of them became ill young with schizophrenia. They didn't have a chance to work, to earn credits into disability, so they are on social supplemental security income, SSI. The federal government sets that amount each year. This year it is $794. So those individuals with serious mental illnesses have to live on $794 per month, while HUD sets the fair market rents for each jurisdiction. And in our jurisdiction, Naples, Marco Island, the fair market rent for 2021 for an efficiency is $948. That's an efficiency. Of course, that's more than the person's monthly income. Sorry. Even if you went to one bedroom home, one bedroom apartment, that's set at $1,118 per month. Our Naples area, as you can imagine, compared to the rest of the United States, where our rents are higher than 96% of the rest of the country. So what do? We find that the answer is providing support of the person to help them, but also each individual is going to need some rental assistance. Whether that comes from a voucher, an assistance from HUD or the county, or it could be in the form of a provider-owned home. The cost per day is generally around $40 per person for supportive housing, whereas those other options of jails and hospitals are far, far more, starting at right around $300 a day. So it's very cost effective, but it also, having real housing helps to improve that individual's quality of life significantly. Our goals with the housing is to increase the number of providers who are offering housing services to people and increase the number of people served in housing. We employ NAMI, a peer specialist, who we've been able to increase from about 10 hours a week to now full-time with benefits, because the need has been there. We've started out with $30,000 in funding, but when this started was more like around 2019, we had a wake-up call. There were 4 women in their 50s living in their cars in our parking lot. For one reason or another, they were not allowed to go to shelter or choose not to. So that's where they ended up, and we just knew we had to do something. So starting in 2019, we had a very small amount of housing dollars and housed a few people that year. Since that year, NAMI alone has housed 64 people who were, most of whom were literally homeless, some of whom had family members with them, children. And also since that time, David Lawrence Center has added a recovery home. I believe it's 6 beds for people with substance use disorders and recovery. And the Wounded Warriors added 2 homes, I believe Alpha and Bravo home. And those are for veterans with mental health and addiction challenges. We've made big strides in the last couple of years. And I think a lot of that says much about how our group has worked together and how we've had significant support from our partners at the county, including Commissioner Solis and Angela. So that's my portion of the presentation. I would like to turn it over to Judge Denise Martin, who's going to talk about priority number 3.
Okay, hopefully everybody can hear me. And good afternoon, everyone. Thank you for the privilege of getting to address you today. I am in the courtroom. If it looks a little bit weird in here, that's why. I'm going to speak with you about priorities 3 and 4. So priority 3 is a data collaborative or data sharing effort. And our goal there is to establish a collaborative of mental health and substance use disorder data so that the various agencies serving persons suffering from that can know what's going on and can communicate effectively to collaborate on solutions. I think probably the superpower, if you will, for Collier County is that we have incredibly strong collaboration. The agencies that serve our community, the court system, the sheriff's department, the county commission, NAMI, David Lawrence Center, St. Matthews, the shelter, so many of the agencies in this town who serve persons with substance use disorder or mental health disorder collaborate brilliantly. And we're way ahead of the curve nationally in terms of how the leadership of those agencies approach the problems, reach out to their colleagues and look for solutions. But one of the things that we recognized early on as we started to come together under Commissioner Solis' leadership was that there really wasn't any central repository for data. And so I left off the hospital on my list there a moment ago. The jail might serve someone, David Lawrence Center might serve someone, St. Matt's, Naples Community Hospital, and none of those agencies has any way to know whether services are being duplicated, whether there could be a collaboration which could help that person exit the need for further services. And so working on a data collaborative has been, well, we prioritize these. So that's been made our third priority after the central receiving facility and housing. And really, there's a few different reasons we need to have centralized data. We need to know what we're doing, and we also need to know what we need to be doing. And when we have, sometimes the word you hear is silos. We have various agencies doing their best to keep up with the persons they serve, and they have no idea that other agencies in the community are also doing the same. We don't really know, because of that lack of centralized data, we don't know what the gaps are in our ground game. And we don't know whether we might be able to move some resources slightly over in this direction to then actually address something that's affecting multiple agencies. And so we've been working on setting up that collaborative, and Sean Callahan with the county, I think, has basically taken the lead on that. I got a bit of an update from him. He indicated that there's been a request for proposals pending for some time, and that the county just selected the vendor to put together this collaborative for us. And that will, they just selected them on May 3rd. The county is now negotiating a contract with that vendor. And then once there's a contract, Sean indicates the county will form a steering committee and the stakeholders will begin meeting to figure this out. We are not the first community. In fact, we've been speaking with similarly situated communities around Florida who have already done this. And we've gotten, I think, some decent ideas as to what our strengths are starting out and what our needs may be in terms of getting this collaborative together. And to answer what might be a common concern, this is not going to be a violation of privacy for the persons that are being served. This will largely be de-identified data, which is a phrase I've learned. So it's not that folks are going to violate privacy and share hospital records with deputies and back and forth, but the data is going to help the stakeholders in the jail, the sheriff's road officers, the David Lawrence Center, the court system, the hospital, going to help us all know who is it that needs us, what are we doing to help them, and where are the gaps that we need to fill in. Data is also critical in securing grant funding and other forms of funding, and this will help us measure the work we're doing, the outcomes we're getting, and help us hopefully unlock some other dollars to further enhance our services. So that's a little bit about the data. And the fourth priority is the justice system. And this won't surprise anyone to know I worked on that. But what we're aiming to do there is to increase both the capacity and the effectiveness of the justice system's response to persons who have mental health disorders and or substance use disorders. So that implicates law enforcement as well as the courts, as well as community services that partner with the courts. As was mentioned at the outset, I had the privilege of presiding over our drug court. Until fairly recently, I also presided over our mental health court and our veterans treatment court. Those are the three problem-solving courts in Collier County. I'm very proud that our drug court has been named a national mentor court, one of only 8. And so courts from around the country are coming to look at Collier County and what are our courts doing to address these needs. That's great, but we've got a really, really long way to go. And what we're trying to do with this priority is to take the lessons of our problem-solving courts and figure out how best to apply them throughout the system. Things like my drug court team is trained in mental health, in substance use, in trauma. And so my prosecutor, my public defender, my probation officer, they're all versed in those things, at least to a basic competency. And in the vision of priority 4, everybody who works in the system, not just the drug court judge, but the family court judge, the juvenile judge, the civil judges, would all be trained in some of those basics so that we could recognize this is a person who may have a treatment need. And the clerks, the bailiffs, the prosecutors, and defense attorneys all will benefit from the same special education that our problem-solving court team members have. And so with priority 4, we're aiming to push out that education to all the various stakeholders in the justice system. The Sheriff's Department's done a brilliant job with crisis intervention training, CIT, to train deputies on these issues. We have done some training, but need to do more with our prosecutors and defense attorneys. Judges, during the pandemic, one great silver lining has been online education has gone completely through the roof. It's been free, it's been high grade, and we've been able to attend them just like you are this, sitting on our lunch break and tuning in to get some information that's incredibly valuable. So I'm thrilled to report that the pandemic probably shortened the timeline of pushing out a lot of education on trauma, substance use, mental health, even to judges who are not running drug courts, but might have a family court docket or domestic violence docket. So the education is going out to the stakeholders. We intend with this priority to continue to support that enthusiastically and to bring to bear a justice system that is mindful of the fact that there may be treatment needs with the persons that we serve. And it doesn't mean that that necessarily equals a pass or a stand down for the justice system, but it does mean that if we want to modify behaviors, if we want to avoid recidivism, if we want to shepherd the children through a difficult divorce, we as judges and as justice system people need to understand these things and figure out how best we can facilitate those persons accessing treatment so that their needs are met and they make it through the system efficiently and effectively. So that's my quick recap on priorities 3 and 4. And now with priority 5, Lieutenant Weidenhammer with the Collier County Sheriff's Office.
Thank you, Judge Martin. Hello, everyone. First of all, I'd like to thank all my colleagues that are on here as well. And especially to Michelle and Trista and their group for keeping the ball rolling on this and keeping this out front with our community. I also want to thank Angela for sharing her story today. Such a powerful message that you're sending. My priority today, which I'm not going to take a whole lot of time with you today, but is on the non-emergency transportation plan for individuals who have been having some type of crisis, had to go to the emergency room, and upon their medical clearance is now having to go to David Lawrence for their care and treatment. For many, many years, the Sheriff's Office has been tasked with doing that non-emergency transport of individuals from the hospital to David Lawrence. And I'm only speaking specifically inner county, right here in Collier County. We are one of the Collier County Sheriff's Office is one of the few agencies left within the state who is still tasked with doing that non-emergency transport of folks. And very briefly with that, I'm sure some of you can imagine that having law enforcement go pick someone up from the hospital that's been taken there who is under the Baker Act and or the Marchman Act, which is a very low percentage, having to go pick them up after they've been medically cleared to take them to David Lawrence for care and treatment is very stressful on the individual and can also be very traumatic. So recognizing that, we decided one of our priorities would be to try to get the sheriff's office out of that non-emergency transport and do that with a more humane transportation from the facility to David Lawrence that was a lot less stressful and did not have as much trauma, by looking at other means of doing that. And right now that may be a non-emergency transportation company within the county that would facilitate those transportations. We are still working on that. That is going to require work between obviously David Lawrence Center, Naples Community Hospital, and Physicians Regional Hospital, because those are our local hospitals here in the county, to arrange for that transportation. And there's a lot of things that go with that. I will tell you that the sheriff's office, we, in 2019 and 2020, each of those years, we did somewhere over 1,600 Baker Acts. Out of those, many of those went to David Lawrence, but some of those did go to the hospital. And out of those, the sheriff's office did close to 400 non-emergency transports of individuals from the hospital to David Lawrence. Now, I ask you to imagine, and many of you have probably heard me say this, I ask you to imagine that you were taken to the hospital and you needed to, let's say, go to Tampa General for something. And I'm sure you don't feel well. And I can imagine how you would feel if a law enforcement officer came and might or might not handcuff you. We try to talk to our officers about not handcuffing folks in these types of situations if they don't have to. But then we transport you in a marked squad car to that NICS facility. And I'm sure that many of you would not be comfortable in there. I don't like to ride back in the back of a squad car just on a given day. It's close quarters. And then the trauma and the stress that that can cause by us transporting you. On top of when we look at how long of a time it takes officers off a line where they may need to be responding to some emergency situation, and they're not able to do that because they're involved in a non-emergency transport of an individual from a hospital to David Lawrence Center. When we also look at that from a cost measure, that's not the most efficient way to do that either. So we are still working on that. We're still moving forward with our subcommittee on trying to get that resolved and get us out of that business, the sheriff's office transporting non-emergency folks to David Lawrence that are going there to receive care. We have to stop criminalizing mental health and substance use within our communities, and Collier County is no different. So that's where we are. Again, I'd like to thank everyone, and I thank all of you for being here, also hearing what is going on within your community, because it takes a community to change these things, and we need your support and your care with that. I will now introduce Dr. Paul Simeon, Doctor Extraordinaire. Take it away, Paul.
Can you see me? Okay. Good afternoon, everybody, and thanks to the League of Women Voters for sponsoring this. These are wildly important events, and that's not surprising coming from me, given that I'm going to introduce priority 6, which is on prevention, education, and advocacy. But before I do, I just wanted to take a point of personal pride. You might have noticed that I'm the only person from Lee County on this committee, having been invited by Commissioner Solis when I first got down here from Boston a few years ago. And I can't tell you how honored I am, not only to be crossing that line from Lee County into Collier, but also to have worked with such a really talented group of friends and colleagues. You in Collier County are really lucky to have this group of people working on behalf of you. So I just want to say thanks to Commissioner Solis and this group for including me in such an amazing thing. So the Priority 6 group had really three major goals and objectives. The first was to reduce the loss of life due to mental illness and substance abuse. You probably have heard this a number of different places, but prior to the pandemic, we were making some good strides in managing opiate overdose deaths and getting our arms a little bit around the suicide epidemic. All of that has been erased. The CDC data that just came out shows that we're now up around 81,000 deaths due to opiate overdose deaths, and suicide has comparable increases. Really heartbreaking. So this is very important for us to work towards that goal to limit that kind of damage. And of course, associated with that is the need to reduce stigma and to let people know that there are all manner of resources out there that they can leverage to get better. Stigma is a particularly gnarly problem down here. I came here from Massachusetts, as I said, and Florida has a bit more of a problem with that than in other places that I've been. I think we're just a little less evolved in our thinking on that. And the other thing I would say about stigma is I don't particularly like the term stigma. I think about it as really more accurately discrimination or prejudice, largely based on ignorance, that people don't have enough experience with people who have these sorts of problems. And so, pass all manner of judgments about who people are and who they, what they do and that sort of thing. And it's our job really to help them get to a more enlightened place. And then the last thing that this group holds as a priority is just to let the community know that we care about the well-being of the county and taking a holistic approach to wellness, that mental health and substance abuse disorders are, stand at the center of all of that. So now, despite the pandemic and the lockdown, the Committee for Priority 6 has really achieved a lot. And to carry out this mission, what we've done is to gather a group of quite amazing subcommittee members made up of physicians, clinicians, public relations folks, communication experts, and peer supporters. And so one of the first initiatives that we took on was to develop a community educational research program, sort of like what we're doing here, to speak to groups about community mental illness. And when we do this, we have sort of three elements that are really important to us. The first is to share what the impact of mental illness is on the community, how this particular coalition got together and took it on, what the 6 priorities for our strategic plan were, and then how best to go about addressing these issues in the community. We also make as a central organizing principle, trying to talk about the warning signs and symptoms of mental illness, suicide, and as you might expect, substance abuse. These are all, of course, all wrapped up around one another. These are conditions that are highly comorbid with one another, around 60 to 70%, despite our best attempts to sort of lower those numbers. And then the last thing we do is we try to find somebody who is willing, courageous, and inspirational, like Angela, to share their personal story. As you might expect, people's personal stories are really the most compelling of anything we can do. Angela's was especially heroic in my view, beautifully, eloquently stated, and heartfelt. And to me, that beats all of the statistics that one can bring to bear in describing what's going on in our country. So let me just say that since September 2019, we've had 17 of these sort of community sharing events reaching around 750 people. And some of the groups that we've spoken to are the Continuum Care Coalition, the City of Naples, the Leadership Collier, the Naples Rotary Club, et cetera, et cetera, et cetera. And we've gotten really fabulous feedback from people about the impact of this. Lots of people were, when I've gone out and do this, people tell me I had no idea that this was going on. Can you come and talk to my group about this? I know people want to hear about it. So we've gotten all manner of really wonderful feedback about this. And so we're hoping also that you feel the same way about this. Moving forward, the calendar is getting booked. And so those of you who might want to have some of us give this chat, that would be good. And so I'd recommend that you sort of schedule that sooner rather than later. So I want to, having this opportunity, I want to ask the League of Women Voters to give us a hand with one thing in particular. I noted at the very beginning that one of your missions is empowering voters, and what I'd like to do is to ask you to help us with this. I have been involved in advocacy work for a long time, and especially when I've come down here. And I can tell you that in my experience, the traditional forms of advocacy, especially in Florida, don't work very well. This has been an enormously frustrating and difficult experience for me in particular, and those of us in the community who are really trying to meet the need. I believe, as I did in the 90s when managed care came to Massachusetts as one of the early states adopting managed care, that the next revolution in healthcare has to be consumer driven. Those of us who are providers have in some sense been disenfranchised from helping because we're seen as being hamstrung by a conflict of interest. I don't quite understand that point of view, but many people hold it. And so what I'd like to ask for is help in what I think about as a kind of disruptive advocacy or activism. Activism often gets a bad rap because it's sort of seen as, tied to revolution of some sort or another. But I can tell you that looking out over the sort of scorched landscape of mental health and substance use disorders in the United States, and in particular in Southwest Florida, we need all the help we can get. And so I'd like to ask the League for their help. And I want to remind them that it was the Enlightenment philosopher Jeremy Bentham, the great utilitarian, social jurist, activist, who said that publicity is the very soul of justice. And mental health and substance use disorder is a social justice issue. And we need as a group to help our politicians understand that and move them from talking about helping us to actually doing it. So I want to thank everybody for your kind attention, and I'll turn it back to Michelle to kind of take us to the next phase. Thanks very much.
Yeah, thank you, Paul. Members of the League of Women Voters and guests, as you can see, much has been done to help further the objectives of the county strategic plan. And as Dr. Simeone had mentioned, we certainly would love the League to join us and partner with us to combat these heartbreaking, life-threatening illnesses. And with that, I'm going to open it up to questions. And I see that we have a lot of questions. So when I direct these questions to our committee members, if we can be brief in our responses so that we can try to get them all in, that would be great. The first question that we have is, will the new facility be located in Golden Gate? I knew the committee was looking at different locations. And Nancy, I am going to ask you to address that if you could, please.
Yes, I'll address that one. And then I think there's one more about the children, if they'll be in that one. Okay, so yes, the commissioners approved unanimously to place the new facility on undeveloped 5 acres that's currently owned by David Lawrence Center, but that has been gifted to the county or will be gifted to the county. It's on the, it's near our main campus in Golden Gate. So it's just east a bit on the other side of Parkway Life Church. So it's undeveloped currently, and it will be built based on design. We're still discussing now what is the best way to maximize the $25 million, and knowing how much demand has grown even in the 2 years since we've started planning. So there is consideration that we may choose to renovate the current inpatient unit that we have now for a dedicated children's facility and move all of the acute adult services to that new facility. So that's being looked at right now. So there could be some separation and keep the children where they are now, have more room for them because of the limits of $25 million to build in the new facility. So I hope that answers the question.
Yes, thank you. Thank you for taking on both of those questions. The next question is related to caregivers. Is there any support for caregivers? And this is a question that comes up often for us because so often we focus on the individual suffering with the illness and addiction, but we forget the caretakers and how stressful and draining it is on them. I'm not quite sure which panelist I should direct this to. I'm almost thinking the lieutenant, but then perhaps Dr. Baker or Paul, Pam, I saw that you, okay, very good. You want to take that one first?
At least in part. I just want to mention that NAMI has a support group for caregivers understanding those challenges. Our support group is led by a peer, a person who has those challenges herself at home and has gone through specialized training. And that support group meets on Wednesdays. I think it's the second Wednesday of every month at 5. So if you're interested in more on that, I'm happy to provide that for you. But that's one thing that we do for caregivers. We can also provide some financial assistance if someone is living in the home with them. That might be possible to provide some rental assistance to help that caregiver. So there may be somebody else who has some other information. Thank you.
Anyone else, any other panelists that want to chime in on this? Maybe we'll cover, yes,
I would
Lieutenant.
say not just, well, I guess a lot of times folks are caregivers. If we look at the substance use side of it, and I would look to Nancy as well, there are many programs out there for family members, parents, spouses, children, older children, I would guess, on Al-Anon and some of those groups that caregivers can go to better understand what their loved one is going through and how best to help them and to navigate through those difficulties that their loved one is having. So there's various different things out there. I know a lot of times when we think about caregivers too, we think about some of our senior groups, and there are some groups out there for our seniors who are caregiving for our elders, because I know that was one of our special interest groups that we had, and looking towards our senior center that's here in Collier County that is expanding and growing. Some of our other organizations that are out there, which right now are not coming to my mind as far as their name, but we do have organizations out there. And I know that Pam there at NAMI, their folks are very good about having information on that. And I know that DLC is good about having information too for family members that are maybe even just looking for respite care as well. So I would say reach out to some of us in those areas, and we'll try our best to help and do what we need to do to help you. I hope that helps.
Michelle, may I just speak to that just very briefly? I promise to be quick. From an education, prevention, and advocacy point of view, I think what we need to do is to empower families to get more involved and help them do that. I think that, anytime you talk about behavioral health or SUD problems, substance use disorder problems, you are de facto speaking about family involvement. And I think, if I can just speak for myself for a minute, I don't think that we've done a great job doing that. I think that oftentimes, families are sort of separated, or they're not included they're not offered an invitation in a direct way. And so I think that the inclusion of families, caregivers more broadly defined, needs to drape itself over all of the priorities that we're talking about. in order to effectively and efficiently address these issues. So that's what I just want to add my 2 cents on that. Thank you.
Thank you, Dr. Simeone. I see that we have several questions related to children. And committee member Caroline Brennan, who heads up the mental health services at the Collier County Schools, is with us as well. Caroline, can you address some of these questions? I have one. How do children's mental health needs fit into the strategic plan? Any special focus? Also, they're asking for resources for children. Can you share with us some of those thoughts?
So while the strategic plan did not directly address children, because I think the perception actually and the reality is that Collier County has been doing a fairly good job in terms of addressing the needs of mental health for children in our community. And by that, I mean we've come together and created the Collier County Mental Health Work Group Collaborative, which includes organizations like the David Lawrence Center, Naples Alliance for Mentally Ill, even Lee Memorial Kids Minds Matter, the Collier County Sheriff's Office, any agency that has any impact or anything to do with our children and mental illness, or even just social service related. Department of Children and Families sits on that committee as well. Probably 40 to 50 different agencies currently participating. And we work together to discuss what are some of the systems we need to put in place to help for access to services, where are barriers being put up, and what is needed in the community. We have a really good, strong working relationship with David Lawrence Center, and they do provide a lot of prevention programs within our schools as well. Catholic Charities is currently providing supplemental mental health services at 14 of our school sites. And the Shelter for Abused Women and Children and Project Help are providing some of our prevention programs as well. Naples Community Hospital has realized the need for pediatric mental health services in their emergency room, and they have hired a new behavioral health person for their pediatric emergency room. Healthcare Network collaborates with us on that work group, and they have also established a new mental health navigator to work directly with the schools and with mental health centers in the community to serve children's needs. Lee Memorial Health Kids Minds Matter is now providing 2 mental health navigators to Collier County Public Schools to help work with families that have more comprehensive mental health needs, sort of a lot of interagency system involvement to help them be able to navigate those and be able to break down barriers to receiving services. Collier County Public Schools has implemented a mental health assistance and allocation plan in accordance with the new Senate bill. And so we have hired licensed mental health professionals serving our schools this year. We currently have 12 of those serving our school district, and we're looking to expand that to 21 licensed mental health professionals next year. So hopefully that will help assist in providing direct services and support to students on campus, as well as helping them navigate mental health services within the community. So I think we've really come a long way in terms of providing additional resources and services to children. And I think we have a really strong collaborative work group that continually, and you know, Dr. Simeone talked about working in silos. We really do not work in silos when it comes to children's mental health. And we've been doing that for quite some time now. And I think that a lot of our area agencies that serve mental health in children have really been active partners in participating in that. So hopefully that answers that question. We also do have, David Lawrence Center has a lot of prevention programs and programs for parents and caregivers on their website. And the Collier County Public Schools has added a mental health webpage as well for people to access resources there.
Thank you, Caroline. So much work you guys are doing to help our children. And as Judge Janice Martin says, the county superpower is in collaboration. We do so well in working with each other. So thank you for that update. I have a question regarding the Homeless Coalition, and we also have committee member Michael Overway. He's the executive director of the Hunger and Homeless Coalition for Collier County. He's on the line with us today. He happens to be on vacation, but made time to join us. So Mike, I have a question. It says homeless coalitions are required to gather data, usually in a homeless management information system, and it allows a common intake system. Are you working with the homeless coalition here to incorporate the information and use the intake information? Many of their clients are mentally ill and abuse substances. Can you speak to that, Michael, please?
Yeah, so a number of years ago, we implemented the HMIS, or Homeless Management Information Systems, in the community. And that system has built-in protections for data. So it has visibility settings that allow us to share across different mediums of services. For example, David Lawrence Center is a partner in that HMIS system, as well as NAMI, Wounded Warriors, several that are on this call today. And that data we use in its aggregated form to report up to the Department of Children and Families and to the Department of HUD, which allows us to bring more funding resources into the community. We do a singular intake application across all of our community partners that participate in the HMIS system. And the HMIS system is one of the reasons, I think, why we took the step with the data collaborative, because we saw how important the data is. And we also know that not every agency in the community is going to discard the current data system that they're using to join ours. So the whole idea behind the data collaborative was to take data from HMIS, take data from the hospital, take additional data from places like David Lawrence Center and NAMI, and use that data to help us, again, evaluate where we are today and where we need to be going with services in the future. So the HMIS system in Collier is very readily used. We currently have about 139 programs that are entering data into our system today.
Thanks, Mike, for that. I have a question that came through to me on my text, and this pertains to our veterans. Also, another committee member for the coalition is here with us today, Dale Mullen, president of Wounded Warriors of Collier County. And Dale, I'm going to ask you to address this one. Here it is. What are some of the biggest challenges our veterans are facing with respect to accessing mental health support? What are the barriers for them to get help? How are the coalition partners working together to address these challenges?
Thank you, Michelle. One of the biggest issues that veterans face with mental health issues today are lack of availability of resources. The VA really is on overload, and veterans are experiencing about 22 veterans a day are committing suicide, about twice the national average. And having access to for clinicians that are trained and also healthcare providers has really been lacking throughout most communities throughout the United States. And we have come together in this community really to address that issue. And one of the things that we have been doing is to provide a caseworker here in Collier County to address just issues with veterans dealing with mental health issues. And we have pulled together what is called a VCAN, which is a Veteran Community Action Network made up of the VA, Collier County Sheriff's Office, David Lawrence, Hunger and Homeless Coalition, and also with Wounded Warriors of Collier County to address unique needs of veterans that are facing mental health issues here in our county.
Thank you, Dale. Okay, so we've reached the 1 hour mark. It's 1:05. We have a lot more questions yet. So I'm going to ask a couple more, see if we can fit these in. One question that was addressed regarding the Collier County Public Schools and addressing mental illness, or the Baker Act for Children. I'm going to ask that audience member to contact Caroline Brennan. Perhaps Caroline, you can provide your contact information with that individual so that you can share a little bit more information about that. Then I wanted to also get in this one question about Yes, and this is for Dr. Paul Simeone. What is being done to recruit more mental health professionals to Collier? I know you're in Lee, Dr. Simeone, but I know you're running the gamut. Can you address that, please?
Of course. Great question. So I'm not sure people know, but that Southwest Florida is considered to be a workforce shortage area for behavioral health providers. And the reason for that is that we don't actually, the salaries are incommensurate with the cost of living down here, and we have a great deal of difficulty recruiting and retaining people. So what we've done more recently, and this is sort of apropos of the legislative advocacy work, myself, Scott Burgess, and Stacy Cook from Salus Care, CEO of Salus Care, went to our respective legislative delegations asking for two things. One was if they could support increasing particularly Medicaid reimbursements and other commercial reimbursements for behavioral health services, because the reimbursements don't typically pay for the services provided. And then secondly, to implement a series of programs that would help recruit, young professionals down here who might want to work either in pediatric or adult behavioral health. And, not surprisingly, people listened dutifully, but we didn't get too far with that, which is why I've said to the league that we really need to pivot into a different, more activist strategy. The other things we're doing is within Lee County, and in particular with Kids Minds Matter, which expands into Collier County, have been developing some training partnerships with FGCU. So we are standing up a social work program here at Lee for their social work graduate students. And we also have the Kids Minds Matter Scholars Program for 10 very promising graduate students who are interested in pediatric behavioral health. We give them $5,000 a year for 2 years to help defray some of the tuition costs, just because we want to support people like that. The other thing that I do is I am on the faculty of FSU College of Medicine, where I'm, really trying to help train the next generation of clinicians. And we try to recruit those residents and interns that we train down here. So we're working on this, but it's very important for us to create a farm team. We need to groom people to stay here, but it's a labor of love, and it takes a lot of time and effort. So that's what we're doing. Thanks for the question.
Thank you, Dr. Simeone. I think I've covered most of the questions. I think we're going to cover our last question. President Hoffman, if that's okay with you, just a real quick one. There was a question.
Yeah, one more.
Okay. There was a question as to the services that are being done in Immokalee. I wondered, Nancy, can you address that? Thank you.
I can speak to David Lawrence Center Services in that we have an outpatient clinic in Immokalee, and that is open 4 days a week, and we offer individual therapy as well as medication management, and so doctor time, nurse practitioner time, therapy services, assessment, and also case management and other supports in the community, so in homes, et cetera. And we're always reviewing and seeking to grow those services as well. So I know we have we have that going on, and we're always open to continued collaboration and partnerships to serve Immokalee.
Thank you everyone for being here today and your questions. And I'm now going to turn it over to President Hoffman. Thank you, Madam President.
Well, thank you so much to all the panelists. What an extraordinary program. And thank you, a remarkable coalition. You work together so well. Thank you for your advocacy and such a rich, informative program. And yes, the League is concerned about mental health services, and we will continue to speak with legislators about that issue, because that is one of our concerns. But a tremendous program. because we knew it would be so rich, we did not read bios, and they are available on our website calendar under the May 10th event if you have not already read those bios. But we have had a very impressive program with a very impressive group of professionals. And hope that all of you as participants, thank you so much for listening and asking such wonderful questions, and hope that you will help to support the expansion of mental health services in this county. And so have a wonderful afternoon and hope to see you again.